Hello everyone, my name is Ellis Burtis. I'm going to be covering the topic of Lorazepam. It is also known for its trade name ativan. It is a benzodiazepine, also known as a central nervous system depressant. Some of the objectives we're going to cover today are the physiology of this drug, the pharmacotherapeutics, kinetics, and dynamics of this drug in order for it to achieve its therapeutic effects, some adverse effects and drug interactions, as well as some patient care and teaching that needs to be implemented for this drug to have complete therapeutic effect and outcome for your patient. The class of drug that this is in is a sedative, hypnotic, anti-anxiety agent, so it works for patients who experience anxiety. It is in the chemical class of benzodiazepines, and it is also short-acting. The physiology of this drug, since it is among the class of benzodiazepines, it works by depressing the central nervous system, and CNS depressants slow down the nervous system. And in this image, we see how lorazepam, an example, potentiates the action of GABA, which is an inhibitory neurotransmitter, and it especially works on the limbic system and reticular formation, which depresses the central nervous system. Now we're going to look at how this drug is used in the clinical setting. The pharmacotherapeutics of this drug. It is used to treat patients who experience anxiety or patients who have general anxiety disorders, and is used for short-term relief of anxiety that occurs with depression and patients with insomnia. It can be used with patients who are going to undergo some operative procedures that require them to be unconscious. So it can be given intramuscularly or intravenously. This drug has many off-label uses such as status epilepticus, chemotherapy-induced nausea or vomiting, acute alcohol withdrawal symptoms, and psychogenic catatonia, which is the abnormal movements or behaviors of a person. And this often occurs with patients who may be drug-induced, or also patients who are mentally ill who are taking certain medications that cause this type of reaction. Some pharmacokinetics of this drug is that it is absorbed in the GI and intramuscularly. It can be taken IM, IV, and PO. IM, it takes about 15 to 30 minutes to be absorbed. If it is given IV, it takes about 1 to 5 minutes. This drug is highly lipid soluble as well as highly protein bound. If it is taken orally, it reacts in about 1 to 3 hours, so that takes a longer time. So that's something you may want to teach the patient who is experiencing that they may not receive the benefits of this drug until about 1 to 3 hours after they have taken it. Hepatically metabolized to an inactive substance. So this is something that occurs in only this specific benzodiazepine or oxapam, Serax, is very unusual among the benzodiazepines. The good thing about it is that it is beneficial to patients with liver disease or the elderly. If this drug is given via the IV, it distributes very rapidly to the brain, so that is something very beneficial, and it's best for patients who are experiencing status epilepticus. If you're giving ativan, it is more effective than diazepam in this situation. This drug has a half-life of about 10 to 20 hours. The pharmacodynamics of this drug are that, like all benzodiazepines, it increases the effects of GABA, and we learned that GABA is an inhibitory neurotransmitter that inhibits the effects of the central nervous system. If this drug is given long-term, it can create tolerance in patients, and we learned that patients who experience tolerance due to drugs may have an increase in dosing just to achieve a more therapeutic effect of the drug. That is why this drug is more likely to be prescribed for short-term use as opposed to long-term use, just depending on what condition the patient has. the adverse effects of this drug. So this drug is actually generally well tolerated. However, they may experience some drowsiness, but this dissipates after a few days of taking it. So if the patient complains of this side effect, you may want to tell them that they may continue therapy, but it just takes a couple days for this to go away. Some side effects that also occur with this drug are ataxia, confusion, and this often occurs with patients who are elderly or debilitated. And ataxia is a lack of muscle control during voluntary movements. And so patients with these conditions in these situations, you may want to adjust the dosage. Patients may also experience respiratory depression, and this can occur if it is given in excess before procedure through the IV. There are many rare but serious side effects of this drug, and some of them are cardiovascular collapse, imbalance, and disorientation, sedation. The patient may experience some hair loss, nausea, vomiting, or diarrhea, incontinence, and thrombocytopenia. Now, with the sedation, your priority is going to be to maintain a safe environment for your patient. Just the normal safety protocols that you have in the hospital, like keeping the call light within reach, the patient's bed at the lowest position, and also keeping the bed alarm on so you know when the patient is getting in and out of bed, and so that you can assist them. And so you can look at page 227 to 228 to give you a more extensive list of rare but serious side effects of this drug. This drug has many drug interactions. These are all the interactions that the book lists for you. From the top, alcohol and central nervous system depressants in combination with lorazepam can increase the central nervous system effects. So they may have increased drowsiness or increased confusion. If this drug is taken with antacids, it may alter the rate of absorption, so it may not absorb well into the body, therefore they may not have the best therapeutic effect. It may also cause digitoxicity. If it is given with oral contraceptives, it may increase the clearance of lorazepam. And if it is given with phenytoin, it may increase the serum concentration of phenytoin, leading to possible toxicity. If it is given with probenecid, it interferes with hepatic conjugation, which leads to more rapid onset or prolonged effect of lorazepam. If it is given with rifampin, may increase the hepatic microsomal enzyme metabolism of lorazepam, leading to decreased effectiveness of lorazepam. And with scopolamine, it may increase sedation when administered with parenterally form of lorazepam. And the last drug interaction that is listed is theophylline, and they may experience some possible antagonism of the sedative effects of lorazepam, so it may not be as effective if it is given with this. And on page 229, and that is table 15.2, you can go over some certain nursing management that is involved with each and every drug interaction in case you are in that situation. Some drug interactions that occur with this is that patients may have a higher risk for ataxia if they are elderly. It is not recommended for use in children younger than the age of 18, and if so, you're going to you're going to have a lower dose for these demographic of patients. And it is contraindicated in patients who have hypersensitivity psychosis, acute narrow angle glaucoma, intraarterial use, and children younger than 6 months of age. And like all benzodiazepines, it is a pregnancy category D drug, so most likely not going to be prescribed during pregnancy. Some patient care and teaching that you're going to implement for this drug is to advise the patient that medication can be taken with food, but is not for everyday use if it is prescribed for home use. It should not be taken more than 4 months unless it's prescribed by the doctor. And you're going to avoid any over-the-counter medications because we saw before there are many potential drug interactions that may occur. Teach the patient to avoid activities that require alertness, such as driving, because it causes some drowsiness. Inform the patient that drowsiness may worsen at the beginning of therapy, so just teaching them that that will dissipate after a matter of days. Patients may forget about the additive effects from alcohol use once they adapt to the Lorazepam therapy, or if they do not experience drowsiness in the first place. So you're going to teach them just to avoid driving until the effects of the drug on them are known. They should avoid drinking alcohol completely while they're on this therapy. And if they ingest alcohol, that they should have someone else drive. And if it is necessary to start another central nervous system depressant medication, they should again use extra caution driving until the combined effects of the drugs are known. So just being in correspondence with their healthcare provider on what they should do about certain central nervous system depressants. Now that we've gone over everything, we're going to review what we've learned. We learned that ativan, or lorazepam, is used to treat anxiety disorders. It works by increasing the inhibitory effects of GABA. The major contraindications are psychosis, acute narrow angle glaucoma. The most common side effects are mild drowsiness, ataxia, which is the lack of muscle control during voluntary movements, as well as confusion. The most serious side effect is paradoxal reactions, which are, in example, patients who take pain medications may experience pain from taking that pain medication. For ativan, patients may experience sedation from taking it. Minimizing side effects would be to discontinue long-term treatment by tapering the patient off the medication, and you're going to advise them not to abruptly stop use of medication. And the most important teaching is to teach the patient to avoid taking alcohol and other central nervous system depressants while on lorazepam to prevent additive central nervous system depression. So I hope that this was helpful in learning about the drug ativan, and just remember to look back in the book and to review your notes. Thank you for listening. Have a great day.